Welcome to Words on Water, a podcast from the Water Environment Federation. This is the host, Travis Loop. Very excited today to be joined by a number of guests to share some exciting news around wastewater monitoring and at correctional facilities for COVID-19. I have Shelley Charge. She is Director of the Water Quality Division at the Oklahoma Department of Environmental Quality. Shelley, thank you for joining us.
It's great to be here. Thank you, Travis.
Also joined by Jim Harbridge. He is Manager of Business Development at Hach. Jim, thanks for coming on.
Thank you.
And Amy Kirby, Program Lead for the National Wastewater Surveillance System at the U.S. Centers for Disease Control. Amy, thank you for joining as well.
Thank you, Travis. Good to be here.
Great. So, Shelley, maybe I can turn to you first to kind of give our audience a summary of the news that we have to share.
Yeah, so we're super excited in the state of Oklahoma to be working with Hach, CDC, and WEF. We're pilot testing a new wastewater testing method for COVID-19 that provides rapid results for our facilities to determine if they're seeing changes in the levels of the coronavirus in their wastewater system. We're initially looking at deploying at 5 of our Department of Corrections facilities. We know it's going to be expanded across the country. So we're super excited to be on the ground floor and getting it going. And really, what this is going to do is allow us much more advanced notice so that we can work to protect all of our residents in our correctional facilities and our staff. And this is a program that's being launched as we speak. Through the Water Environment Federation, Hach, and CDC.
Yeah, it's a great partnership there with a federal agency. It's the state, WEF as a nonprofit organization, and then Hach, a real leader in the water sector. Before we dive into it a little bit further, Amy, could you give the audience just an overview of how wastewater is used for disease surveillance, including for COVID-19?
Sure. So this is not a new idea. We've been using wastewater testing for polio surveillance for decades, really since the early 80s. And the idea is to look at the wastewater in a community as sort of a pooled stool sample. So you can look at what's going on in the community overall just by looking at that one sample. And for polio, we use that to identify neighborhoods and communities where the wild type virus is circulating so that then they can go in with their vaccine campaigns. We're using it a little differently for COVID surveillance. So in this case, we're using it again to get an idea of what's going on at the community, but it's not just a plus minus, but we're asking about the scale of the epidemic in those communities. So are cases going up? Are they stable or are they going down? And we can see all of that through this wastewater testing. And there's two real powers to wastewater testing for COVID relative to our other COVID surveillance. So one is that it captures all types of cases. So whether you have symptoms or not, the virus is shed in stool and we can detect it in wastewater. It's also shed in adults and children. So we're capturing the full spectrum of infection that can happen in a community, unlike our clinical surveillance where we largely see symptomatic cases and severe cases in adults. The other reason that wastewater surveillance is really powerful is that it is completely disconnected from clinical care. So we call that independent of healthcare seeking behavior. So it doesn't matter if people go to the doctor or if they can have access to clinical testing. If they are using the restroom and that restroom is on a sewer system, we can see those cases and know what's going on in the community. And those two things really make this a powerful new tool for understanding how COVID is moving through a community. And we do it at the community level for the National Wastewater Surveillance System, but you can also do this at the facility level. So looking just at the wastewater that's coming out of a single building or institution to get an idea of what's going on in that single building or facility. And that's really what we're doing here with this correction study.
Thank you. Jim, I'd like to hear from your perspective about the actual testing technology and why kind of the current approach is inadequate, especially when we're talking about using this to surveil for COVID-19.
Sure. One of the things that Hach looked at was, obviously there's a benefit of the time element of getting your result. And when it comes down to that, you can get maybe a 7 to 10 day advance notice on what's going on in the community, as Amy mentioned. But to do that, you really need to be able to get that answer as soon as possible. And when we looked at what was available technologies to do this, how to extract the virus out of wastewater, they're very complex methods. And we know our customers in wastewater utilities, and they're generally not kind of skilled at, wastewater-based epidemiology, extracting viruses out of wastewater. It's a pretty complex method and probably requires people who are educated in that type of methodology. And so when we looked at what we could do, it had to be simple in order to make that test to happen on site. And if you could do the test on site, it made the result much more actionable, because what we saw, when we started this project was that most, if not all, a lot of these people who were doing wastewater-based epidemiology in universities and communities were sending their samples out to central labs and then getting the results back 5-7 days later. And that time window basically really impacts the actionability of that result. It's almost just a data collection exercise at that, because your advance notice almost caught up with what's happening in the case counts in the community. So we really looked at the method and how could we improve that method so that somebody at a wastewater plant that has a traditional, maybe laboratory background, but not a PhD in epidemiology or molecular biology, could run a test like this. And so we scoured the landscape, and we ended up partnering with Lumen Ultra, who is an existing partner of us, who worked with Dalhousie University to bring in a method that made it much, much easier to run this test, where you could take a sample and within an hour or two, depending on how many samples you're running, you could get your results, and then you could plot it and take action on it without having to wait that 5 to 7 days notice. Plus, it would save you money and all that. So overall, we worked for 3 or 4 months to really optimize the method so that we could make it as simple as possible, mistake-free, error-prone type method, and bring that to market. And so we kind of the latter half of 2020 optimizing that, and then we launched the product in December of 2020 in partnership with Lumen Ultra.
And if I can just build on that real quickly, sorry, Travis. When we're looking at the spectrum of how wastewater surveillance has been used in the past year for the COVID response, one of the big successes, particularly at the facility level, has been universities. They use this very successfully in the 2021 academic year to control and detect outbreaks in their dormitories when they were only a handful of cases versus tens of cases. But the key to these very successful universities is that they had a wastewater lab on campus. So they could collect their sample, take it to these very advanced research labs that they had on campus, and get results that day and act on them that day. But those sorts of advanced labs are not available most places. And so this Hach Lumen Ultra kit that enables on-site testing really replicates that, but without the need for this really advanced research lab. And so we're hoping that we can, again, duplicate the success that we saw with universities, but in correctional facilities with the advantages of this kit.
Shelley, I'd like to hear from you or the state of Oklahoma about how this pilot is going to be implemented, just what it's going to look like.
Yeah, so for us, while we do have a couple of major metropolitan areas, most of our state is very rural. So our correctional facilities are spread out across the state. So we're going to be deploying the test kits with some of our facilities out in rural Oklahoma. We're going to really be testing the equipment where we are, have very limited laboratory capabilities so far. So we're really excited to see how quickly we can get our operators at these correctional facilities up to speed and able to analyze the samples. They're going to be focusing on some individual housing units at the facility so that they can help to isolate the areas where they're seeing the coronavirus showing up in the samples in the prisons. We're hopeful that we're going to be able to really come up with some good results as we're starting to see the Delta variant show up and become more prevalent. We did have some pretty significant outbreaks in some of our facilities, so we want to be able to act quickly if we start seeing another round. We're going to be providing a lot of training for operators that operate some very basic wastewater treatment facilities, and in one case, a water reuse facility. We're going to hopefully be able to build on all of the research that's been done so far so that we can protect our inmates as well as our correctional staff. We'll be sharing the information back with CDC, and hopefully we're going to have not only the data from the test analysis that we'll be able to share with CDC, but also information back to Hach at how easy or what challenges we ran into that you don't even know until you start trying to implement in the field. You never know what those are going to be. The DEQ is working closely with Department of Corrections to make sure that they have the support that they need to do this analysis. We'll be providing some technical assistance and hands-on training from Hach, and then also with the State Environmental Laboratory. So we're really excited to get the project off the ground and hopefully share lessons learned with the rest of the country and build a better wastewater surveillance system.
Amy, last question I had is how this pilot in Oklahoma with these 5 facilities is going to be expanded to some other facilities, and then maybe even how it could go beyond that down the road.
Yeah, so this pilot was funded for 20 facilities total, and we have those facilities spread out across a total of 5 states, including Oklahoma. So there are 4 other states that will be participating in this. And if this pilot is successful, one of the outcomes from it will be guidance for additional correctional facilities for how to implement this type of wastewater surveillance in their facilities and how to use the data. Again, as Shelley said, we expect to be learning a lot about what kind of training and support is necessary to implement this test in facilities. And so all of that will be put together in a package with guidance for additional facilities beyond the 20 or so that are involved in this pilot.
Fantastic. Well, I know that we at the Water Environment Federation are very excited and privileged to be working alongside all of you, the CDC, the state of Oklahoma, and Hach on this really innovative and pioneering approach. Thank you all for coming on the podcast to talk about it. Appreciate it.
Great. Thank you.
Thanks, everyone.
Thanks. Bye-bye.